Hey everyone, so one of the biggest things we are asked often now is what is actually the Part B Medicare buyback or give back plan option that you see on TV commercials. Oftentimes you're getting information in the mail. And a lot of times it's very confusing on exactly what the give back is. I'm going to explain that today and so much more in this video. Stick around, I'll be back in just a second. Hey everyone, so what is the Medicare Part B Premium Give Back? It's called different things. Sometimes it's called the buy down benefit, sometimes it's called the give back benefit, sometimes it's called the Part B buyback, sometimes it's called the Part B Premium Give Back. There's all types of variations. All that means the same thing. Often we see in Medicare Advantage plans now, they will have a Medicare buyback or give back plan. So typically what happens in that situation is they are giving back a portion of your Part B premium that you pay into Medicare. So just to go over some basics with you so you understand how Part A of Medicare works and Part B of Medicare and how the money actually works. Part A is an entitlement part of Medicare. In other words, if you've worked 40 quarters or 10 years or longer, you actually qualify for Part A because you paid FICA taxes in. It enables you to be able to go on to Medicare Part B at no premium cost. Now, if you have not worked 40 quarters or 10 years or longer, and there's an equation that you factor into the income amount that's considered full-time or part-time employment for that credit. And we're not going to cover that today, but if you've worked 40 years, 40 quarters or 10 years or longer, you've qualified for Medicare Part A because you paid taxes in. Or if you've had a spouse or ex-spouse or a deceased spouse that's paid in, you actually can draw off of their benefit. Now, there's some rules around that as well. We talk about that in other videos. You could dive in one of those videos. We can explain the details of exactly what you qualify for based on an ex-spouse. Now, Part A is an entitlement is what I call it, because if you work for it, you're entitled to it. Part B, you actually pay a Part B premium. Right now, the Part B standardized premium for this year is $202.90. For you guys that are high income earners, if you're married or single, if you're single and you're making over $106,000 a year, you just need to check into that amount and above if you're going to have an IRMA adjustment. That is IRMAA, IRMA adjustment we talk about in other videos. But that's just saying that if your adjusted gross income is at that income amount and above, you're going to have an adjustment to your standardized Part B premium. So right now the standardized premium again is $202.90. The IRMA adjusts that up and to the right. If you're married and you're making above $212,000 with an adjusted gross income, again, you may have and that's going to be based on 2 years ago. So 2 years arrears of what this year is. So right now we're in 2026. So your tax filing in 2024 would determine if you had that adjusted gross income at and above the IRMA scale. So what that does is it raises the standardized Part B premium up based on your income. So high income earners, typically $750,000 or more a year, are going to pay the top out amount. So, and you can watch again a video that we explain all the IRMA and go into the details of that. I just want to give a baseline on exactly what does this Part B buyback actually apply to and where is it applied when it comes to your Medicare Part A and Part B. So Medicare Part B buybacks is going to apply to your Part B premium. And I'm going to go over just the steps, exactly what happens in this process, what to watch out for when you're enrolling into these plans, what is good and what's the right type of person. Actually, at the end of this video, I'm going to cover the exact type of person that typically benefits from this type of plan and the type of person that does not benefit. So the Part B buyback, if you are looking and seeing advertisements on TV and it's saying that you qualify for the full $202.90, or maybe it's advertising that you have a Part B buyback to buy down your Part B premium, beware, one, that is typically a third-party marketing organization that's doing advertisements on TV for the potential for you to pick up the phone, call, or if you're seeing something online in a Facebook ad or maybe social media or YouTube, and it's kind of a bait and switch where if you click here and get more information, that a lot of times is going to a third-party marketing organization. They are selling your information to maybe an agency like us. Now, compliant third-party marketing organizations have compliance statements and things on their websites and on their documentation, and you're actually providing the information on a compliant measure, and they're passing that information on to like an agency like us. One of the reasons why we don't like to typically always buy third-party information is because of what I'm going to explain to you. You're getting clickbait in your social media feed, email, phone call, and they are wanting you to kind of sense bite at the worm. If we're using an efficient analogy, they're wanting you to bite at the hook with a worm on there and get you enticed by using the Part B buyback. The Part B buyback does this. It actually buys down a portion or potentially all of your Part B premium. Typically, we'll see anywhere from about $50 up to about $100 on most Part B buyback plans. Where we see a lot of this that applies and really is actually a benefit is when veterans or people on TRICARE, they can actually qualify for just a Medicare Advantage only plan that does not have drug benefits on it because they get their drugs typically through the TRICARE. And TRICARE and VA benefits coordinate with Medicare Advantage plans. If you don't understand that, you can watch one of our videos when we're educating people about how VA and TRICARE combine with Medicare and how they can combine and work with a Medicare Advantage plan. But typically on those MA only plans, what we call veteran-based plans a lot of times, that Part B buyback is going to be a lot higher amount of money. So they will use that as an opportunity to increase their Social Security benefit. So if they're drawing $2,000 a month and they're going to have a $100 buyback, that means they're going to get $2,100 in their Social Security. So that's $1,200 of income in the year. And then a lot of times those plans have some additional benefits and coverage we're going to be talking about at the end. So the benefit of how it benefits some people and then how it takes away from other people. But the Part B buyback is there to help buy down a portion of your Part B premium, which is incredible. The problem is, and what we're going to go into next, is what does it leave you with out-of-pocket costs when accessing care like primary care, doctors, specialists, outpatient surgeries we're going to talk about, and all types of Part B services. And then Part A, what is your copay and cost going to be incurred in one of these buy down plans? What is the benefit of the buy down, but also what is the deficit and what's going to leave you holding the bag in the buy down plans? So let's just say if Medicare is allocating a lump sum amount of money to the Medicare health plan to administer all your coverage for your medical, Part A and Part B services. So Medicare Advantage plans are private insurance companies that have a contract with the federal government. Based in the county that you live in, that the government contract allocates a certain dollar amount per month to be used to administer all your Part A and Part B services. Now, Medicare Advantage plans by contract, by federal contract, have to be equal to or greater than original Medicare. So you typically are not going to see a Medicare Advantage plan that's going to cost you more money than being on original Medicare. Original Medicare, Part A and Part B services are going to have a deductible. They're going to have co-insurance for Part B services. And a lot of times when people are just on original Medicare, there's a population of you guys that are out there, about 11% of the population, that doesn't have anything but original Medicare. And if you have anything catastrophic happen, like a severe heart attack and heart surgeries, and you're in the hospital for several days, and there's several specialists working on you, you can come out with thousands and thousands of dollars of medical expense and bills. We're on a Medicare Advantage plan, they're going to have a max out of pocket. That max out of pocket is going to be less than typically $9,000. Most of the time, the given norm is between about $5,000 and $6,000. So as opposed to being exposed to the high cost of original Medicare, people enroll into a Medicare Advantage plan. Now, the Part B premium, the caveat is you're saying, hey, I'm going to take a buy down. Well, the dollar amount that is given by the federal government to that Medicare Advantage plan, they can only operate on that dollar amount. So that private insurance company has to still provide Part A and Part B services that are equal to or better than. And then also, a lot of them are going to have drug benefits built into the plan. But they also are looking at, hey, we're going to have this buy down benefit. So if they're provided, $18,000 in a given year, and then they have that divided out over 12 months, they have an allocation of that money going toward, a lot of times about 10%, 5%, 10% toward a buy down. That means money is going back to you that does not stay with the health plan. So what does that really create risk for you when it comes to your copay cost and Part A and Part B service costs and things like that? And then what does it do to the additional benefits like dental, hearing, vision, and things like that? A lot of times Medicare recipients are looking for a Medicare Advantage plan to have kind of an all-in-one experience. It covers your hospitalization, your medical, your medication, and then also it has the additional benefits like dental, hearing, vision, over-the-counter benefits, and things like that. So when you start degrading benefits in one part but increasing benefits in another part, you need to really look at the degradation of what benefits are going to end up coming back to bite you if you do have a medical situation or some of the situations I'm getting ready to walk you through exactly what happens to these people once they access care and then they realize, oh, I didn't realize it was going to cost me that much. So what started with an advertisement, something in the mail, a Facebook ad that you thought was going to benefit you by buying down your Part B premium by $50 a month, which is $600 a year, could end up costing you a few $1,000s. On this next part of the video, I'm going to walk you through what the cost is and what you're exposed to with these buy down plans. So what is the, degraded benefits, or what happens when you enroll into a Medicare Part B buy down plan? Okay, any of those that are Part B buybacks or any of the different ways that they call these plans, typically what will happen is you get the Part B buyback premium, a portion of it paid down, but then it transitions that $50 into the copay costs increasing for Part A and Part B services. So what does Part A services look like in the Medicare Advantage plan? That's going to be the hospital copay, typically that is going to average in our Middle Tennessee or around the Nashville market and Tennessee market, it's about $300 per day, day 1 through 5 or 1 through 6. Well, a lot of these Part B buyback plans have a cost of $385 to $400 to $425 a day, day 1 through 5 or 1 through 6. So here you at one point are getting money back, but if you go into the hospital and you stay 5 days or 6 days, you actually have paid equal to the amount of a Part B buyback if you have a $50 buyback benefit. So will that happen? Well, we don't know. We know on the averages, an average senior every 4 years goes in the hospital an average of 2 days. The average stay nationally, the average stay for most seniors that are in a hospital inpatient situation is actually 5.2 days. So if you do the math on that, you actually are not getting back that much benefit for the Part A portion of that plan by paying a higher copay. So I would rather put somebody on a zero premium plan with no buyback with much lower copay for hospitalization. Now let's look at the Part B or anything outside of the hospital. You typically are going to see $10, $15, $20 for the primary care doctor copay, and then a lot of times we're seeing $40 to $60 on the specialist copay. So a lot of times plans in our market can be anywhere from a $0 to $10 copay for primary care access, and really anywhere from about $15 to $40 for the specialist. So if you're going to a specialist multiple times because you have a condition that requires you to go in maybe once a month or once a quarter, that is just a small fraction of money, but when you start compounding that on top of other things like outpatient surgery, if an outpatient surgery on a zero premium plan is $150 for the outpatient surgery, but now on your buyback plan, it's a $400 outpatient cost. When you go in to have that surgery done, you see a deficit of $250. So if you have 2 events in a given year, again, the Part B buyback looks good, but you're actually paying more in copay costs. Now, why does that apply and why does it really matter when we're looking at, and where does this, Part B buyback really apply for those that can enroll into these types of plans and benefit from them? We're going to walk you through that in this section of the video. So to walk you through in this portion, to have an understanding, if you are willing to take a $50 buyback for the risk of having much higher copays, you need to make sure you're looking at, from just a subjective point of view, of what you may be subject to in copay cost if you do have access of care. If you do go to the hospital, if you have outpatient surgeries, if you have, MRIs, CAT scans, PET scans, outpatient services, you need to look at what your normal year is and then what the average senior is. The average senior is going to really be the determining factor of whether or not I would enroll somebody into a Part B buyback. It sounds good, but it can leave people exposed for high costs. Now, when does this really apply to those that benefits from the Part B buyback? Well, typically what we've found is veterans and TRICARE recipients that have a Part B buyback benefits from this because they go to the doctor. They use their Medicare Advantage card and their TRICARE VA card, and what is left over in copay cost is actually filled out and sent to TRICARE, and TRICARE picks up the difference. The only caveat with that, with any Medicare Advantage plan, you're subject to network, to primary care specialists and hospitals that are part of the network of the plan that you're on. So you need to check and make sure you're actually enrolling into a plan that covers all that stuff. If you're needing drug coverage, you need to make sure the medication cost is covered and at the lowest point now that the Inflation Reduction Act has really created a lot of turmoil with medication costs. But for a veteran, a lot of times they're getting their medications through TRICARE or the VA, and they only are looking at the benefits of that plan. So a Part B buyback plan with just a Medicare Advantage only with no drug benefit is actually a great plan because they are not covering the drug benefit. They're going to increase or decrease the copay costs, even though they're covered by TRICARE or covered by the VA benefit typically. But the big thing that happens in the Medicare Advantage only plan with like a veteran or a TRICARE recipient, they're going to still have the dental, hearing, and vision benefits that are going to still be pretty good benefits. They're going to have a lump sum amount of money typically for dental. They're going to have a higher allocation amount for like eyeglasses. And sometimes the veteran is not qualified for some of those benefits. Sometimes they've medicaled out and they do qualify. So you need to ask qualifying questions. You need to determine what type of coverage you have with TRICARE VA, what you're missing out on, and see if you can combine a Medicare Advantage only plan that has a Part B buyback, because it does give you back income. It does provide benefits. I have my in-laws who he's a 27-year retired military veteran. They're on a Part B buyback. So it's a great plan for them because it fits within their network of doctors they want to see, and it gives them a lot of dental, hearing, and vision, and a sizable over-the-counter benefit. Now, if something changes with that plan and it's not going to provide them what they need, they don't need to be on the plan. So you need to ask the right questions. And the moral of all this is it comes back to what you're hooked into on the front end is not always what you think. As the old saying, everything that glitters isn't gold. Make sure you're asking the right questions. If you don't have somebody to work with, you can click below, guys. We'd love to be able to provide an honest, open review, reviewing your options with you, seeing if a Part B buyback is the best plan for you or just a standardized Medicare Advantage plan. If you're turning 65, we have educational content and videos. Please register below. We'd love to be able to talk to you. Until then, I'll see you on the other side.